Kamusta? Namaste.
Namaste. I'm okay. I hope you are well as well.
Thank you so much. Welcome to India's second Metabolic Health Conference. My name is Kunal Jain. I'm a metabolic health coach and a proud member of DLife.in, which is India's oldest, biggest, and the only award winning low carb platform. Shashikant Iyengar and Anup Singh bring to you this historic and scientific feast from India titled Metabolic Therapies. Let's meet our very special guest for this session, Josephine Grace Rohotan, MD. Dr. Josephine
Hello.
Grace Rohotan, also known as the Diet Doctora, is a practicing rhinoplasty facial plastic surgery subspecialist in the Philippines. She is a fellow of the Philippine Society of Otolaryngology, and her specialty is diseases of ears, nose, throat, head, and neck surgery. She also specializes in root cause medicine. On the side, she studied nutrition and discovered the benefits of a low carb uh, eating method and therapeutic fasting for healing and health optimization. She has a large following on social media platforms like Facebook and YouTube, where she posts valuable content to educate people about the benefits of a low carb and fasting lifestyle. She has LCF masterclass programs for lifestyle diseases like diabetes, hypertension, obesity, asthma, multiple forms of allergies, fatty liver, tumors, and even cancer. She has authored the Perfect at Last book series and has also organized the National Low Carb Day NLCD Philippines, which is the largest in-person gathering of low carb practitioners in our country. So before we begin our discussion on metabolic therapies, would you like to greet our audience, Doctor?
Hello. I hope you
All
can
right.
hear
So
me well.
yes, I can hear you well.
Yes,
Thank
Sir
you.
Kunal, thank you very much for that very nice introduction. And first and foremost, I would like to thank you and the rest of the team, Sir Anup Singh and Sir Sashi, for inviting me to be a part of Metabolic Health Conference 2.0. I'm very, very proud of you guys for doing this, and I'm very honored to be a part of this conference.
Thank you, Doctor. It's our pleasure to have you here. Thank you. So let's begin. I would like to uh, ask you this question first. That being a mainstream doctor, what compelled you to come into low carb and fasting lifestyle for yourself, your family, and your patients?
Yes, so thank you so much for that question. So I know I also studied the same way as many doctors, studying the standard diet, the recommendations, especially by American Dietary Guidelines. But after graduating medicine, I think I've been practicing medicine already for around 5 years, that time, 4 to 5 years. I've come across one video educating about the importance of fasting. And from there, I already saw many groups from all over the world, international groups, and I've seen a lot of almost miraculous healing, something that we've never seen before in standard medicine, like a person weighing 300 pounds after just 3 months lost the whole half of his previous weight, and people who've had cancer, who've had diabetes, who've had hypertension, cardiac problems, who've healed their conditions based on just lifestyle change, just changes in food and also incorporation of fasting. So from there, I did my own research, especially that my family also had a long history of diabetes. My father and three of his siblings all died of diabetes complications, all before 60 years old. And they were very, very compliant with medications. Before, I feel like I'm failing him as a doctor, knowing that I'm a doctor, but I can see his condition deteriorating, even if he is very religious with his medication. That's when I start to ask, maybe there is something wrong with just our standard recommendation of pharmaceutical recommendations, medicines. Maybe that's not enough. And true enough, when I discovered about low carb nutrition, I went back to my biochemistry book, first year biochemistry book in medical school, and it is still there. It's all there. low carb nutrition really supports healing through, as we will discuss later on, through the lowering of insulin triggers in our body. So from there, I started applying it with myself and together with my mom. Just too bad my father already passed away that time for around a year ago already before we discovered low carb. But the whole family is now practicing low carb, especially our in-laws. And as you have said, many in the Philippines are now practicing low carb, and there are hundreds of thousands of testimonials saying from their own experience, telling from their own experience how they were healed with this kind of diet. So for me, it started with just curiosity, and from there, I experienced the healing myself because I've had health issues also before. I was diagnosed with pre-diabetes in my early 20s, and that one I also reversed with low carb nutrition, and I cannot help but also help my patients. So I practice low carb together with my specialty as an ENT doctor and as a facial plastic surgeon.
Right. That's great. Uh, so since you have your specialty in ENT, I would like to ask you, how can ENT patients benefit from low carb?
Yes. So as an ENT doctor, actually I myself is an ENT patient because for the longest time I've had allergic rhinitis, and I've been maintaining antihistamines and intranasal steroid sprays daily, and sometimes I even need to overdose myself with antihistamine. Usually it's just given once a day. But in order to control my symptoms and in order for me to be able to do my work on a day-to-day basis, I need to take more than what's just recommended, because after a while, my body seems to have developed some kind of tolerance with antihistamines. And only with low carb nutrition, clean low carb nutrition, and therapeutic fasting that I experienced reversals. Since then, I've never had bouts of allergic rhinitis the same way before. And as you all know, allergic rhinitis is now part of one airway disease. So sometimes it may represent just as allergic rhinitis, but it can also fall into asthma. And from an asthmatic attack, if there's severe cases of asthma, sometimes the patient will have a degree to have developed pneumonia, and that can be a very big problem. So allergic rhinitis is one, but generally when it comes to the same way as fatty liver, type 2 diabetes are affected by inflammation, the same things are also affecting a lot of ENT conditions, except maybe for infections like ear infections. But even with infections, low carb nutrition can help because the body's response to infection is actually much better. And with just mild antibiotic, not needing high doses of antibiotics, the infection can just resolve like right away. Another experience of mine when it comes to low carb was with vertigo. As you all know, maybe if you know anyone with vertigo, it is considered already as an ENT concern that's going to be their lifetime. Like there's no cure for it. There are many medicines to help it, like betahistine, but patients with vertigo know that it cannot be completely eradicated. The symptoms will just be milder, but it doesn't really go away. But only with a healthy, clean, low carb nutrition was I able to see patients really have no symptom at all. And just like diabetes, it can be reversible in two ways. The moment you go back to your inflammatory way of eating, inflammatory kind of eating, then those you can expect that diabetes, just like just like vertigo, can also come back. So it's a two-way process. So if you want to improve those conditions, then you might want to really stay on a healthier kind of eating. If you can forget about sugar, if you can forget about inflammatory foods, those toxic seed oils, then much better. So many cases in ENT and head and neck surgery, even just wound healing when it comes to trauma for those patients that have fractures, I see myself, I see it, I see it on my own with patients that their swelling after surgery and their recovery will actually be much faster. Their swelling will be gone in only 3 days time, and the bruising even, it's not so much as compared to those patients who are not compliant with my dietary recommendations, and as well as other conditions in head and neck like thyroid problems, thyroid cancers, thyroid nodules, or goiter. Those are also caused by many others, including nutritional deficiency. So I know that they can all benefit from low carb nutrition, and I've seen it myself in my practice.
Thank you. You are a firm believer in intermittent fasting. So, how
Yes.
does intermittent fasting help in your area of medicine, ENT?
Yeah, so as what I've mentioned a while ago, I actually discovered intermittent fasting first. And from there, I also learned low carb. So I really believe that if you want to get the most out of this lifestyle, you have to really practice both, not just intermittent fasting, but also low carb nutrition. If you do low intermittent fasting alone, you might have a hard time during your fasting window because your body has fluctuating blood sugar levels because you eat high carb during your eating window. But if you eat low carb during your eating window, then there will be no fluctuations in your blood glucose. So you can just go on in a day eating only one meal, maximum two meals, because for those, especially for those who that needs to lose weight, they can easily just burn their own fats and make it as a source of energy. So intermittent fasting really helped me as my practice also with ENT. The only challenge that I only encounter would be when patients need to take antibiotics, especially strong antibiotics that needs to be taken with meals, or else they might have GERD or hyperacidity that can cause a lot of stomach discomfort. So for these patients, I try to give them, if possible, the twice only dosing of antibiotics so that at least they can still fast for around at least 12 hours in a day. But for those who are needing antibiotics, say for example, every 6 hours, then I tell them that it's okay if you cannot do intermittent fasting for now. What is better, what is more important now is for us to take care of the infection, and that can be well taken care of if you can take your medicine at the right time and you can complete anyway. Most antibiotic therapies is just around 1 week, maximum 2 weeks, and then they can just go back to intermittent fasting right away. So those are
Right,
exemptions. So I am a believer of intermittent fasting, but I also believe that there can be a right time for everything, including intermittent fasting. So I don't force intermittent fasting on patients who are breastfeeding, for patients who are underweight, and also for those who are still growing, like children or babies or pregnant women. But the rest, if they can accommodate, if they can do intermittent fasting together with low carb, then I really recommend it. Just a minimum of 12 hours to 14 hours, it can already do wonders. And patients have been very happy with the results themselves. They were surprised actually how they can easily adapt to intermittent fasting. Before, they cannot imagine going on more than 8 hours without food, even after an overnight fast.
right. Thank you. You have been doing amazing work in terms of low carb and fasting lifestyle in your country. Can you please tell us about what changes you can see happening at the grassroots level, and how is the low carb and fasting movement picking up in your country?
I am so happy to be one of the first doctors in the Philippines to really be open and loud about low carb and intermittent fasting. And after 5 years, it's been 5 years now since I've been openly talking about low carb nutrition. After I first published my books way back in 2019, it's available in Amazon. So it's a three book series. It's Perfect at Last Weight, about fasting. It's Perfect at Last Health. It's about what foods to eat in order to heal. And lastly, It's the wellness. So it's an overall package. And those books I published in 2019. So it's 5 years now. And right now, I'm so happy that whenever I go to especially major cities and even in cities that are kind of rural in area, in origin, there's already low carb food providers.
Wow.
So this it's already an option. And every time I see in the grocery with label of keto or low carb or sugar free, it's already for me it's already a victory. It's already a start. So and I can hear like the last time because we are currently on vacation. That's why you can see some people passing around behind me. And last time while we were at the airport, we can overhear people behind us talking about low carb, the
Wow.
saying that whenever they do like dirty or not so clean low carb, they feel bad, but they go back to clean kind of low carb or strict low carb. So these are fathers or other common travelers or workers that are already practicing low carb. So hearing that and knowing that they're already stores with franchise of low carb products all over the country. For me, that's already a victory that we can see. And I'm so happy that the number of doctors also who are practicing low carb now is getting plentier and plentier. Not everyone is as loud as me yet or as open as me, but I've seen patients that are telling me that their endocrinologists actually recommended watching my videos. They have obstetricians who are also giving away the food list that I made, the safe, caution, and danger list, food list that I made in order for them to be guided on what to eat. So that's basically a low carb food list, the strict low carb food list, and the caution one would be the food list on you can consume on low carb but on moderation. And the last one would be the ones that you really have to avoid as much as possible when you can, or take it as minimal as possible. So those are the ground root level of changes that I've already seen. And we are so happy and proud that many people, like right now, we have more than 300 live Facebook viewers in this platform for when I share this our interview right now. And people are also commenting their own journey, posting their before and after photos, not just on weight loss, but also on their even on their laboratory results. How from the longest time they've had HbA1c of 10, 11, 12, 13. Now it's down to 6. Now it's down to 5.5. Even and my brother's friend, close friend, who's as young as just 37 years old, very athletic and very fit, but had SGPT liver enzymes elevated, and only after a month or two of low carb, it's now down to normal. So those are the stories we hear every day. And even if I'm hearing it every day, I still cannot help but be thankful and be grateful. And it doesn't stop. It doesn't stop to surprise me each time because I'm just so happy of this kind of health improvement that we see on an everyday, day-to-day basis.
Thank you, Doctor. It's so heartening to hear that the impact you're creating with your work and educating the people. And congratulations to everyone who has benefited from low carb and fasting lifestyle. It's amazing. So,
Yes.
coming to the next question, you had recently organized the International Low Carb Awareness Week conference where Anup Singh and Shashikant Iyengar participated from India. What was the impact of that conference in your country and how was it received across the world?
First, I would like to take this opportunity again to thank Sir Sashi and Sir Anup for participating. It was received very, very well in the country, in the Philippines, knowing that there were international speakers, there were international doctors, and even the head of the carnivore, the leader of the carnivore in the world, also participated in that, Dr. Sean Baker. And yes, we were able to achieve our goal of making an awareness, increase awareness. We scheduled that on the first week of December, just before the start of the holidays, the December to New Year holidays, because in our country and in many countries those really are time to celebrate and eat a lot. So we want people to be somewhat aware so that they can choose better on what food to eat, especially on those feasting times. And
Yeah,
in the world, I believe that it also made an impact, no matter how little, knowing that people from first world countries and even to third world countries are already aware of low carb and are already practicing. And it's regardless of your financial capacity. Anybody can do low carb nutrition, just like an event that I held last month. We had a meet and greet and book signing event. And one person I met there was someone who is working in construction as a construction worker. But he'd been on diabetes medications for so long, and he had been praying that he doesn't want to take medications on diabetes anymore because it's financially disabling, and he can feel the side effects of diabetes medication. And that's when he learned about low carb, and he's very, very thankful. So with a minimum wage, still he was able to do low carb nutrition successfully. So I'm happy that you guys were able to be there on that conference, and just like the same way that we are all in this conference right now. So I believe these are contributing well to our low carb community, wherever that may be. And I hope to continue this kind of conferences in the coming years.
definitely. So, doctor, what is the consumption trend of fast foods or all the high carb, low fat foods in your country? And are they impacting any ENT issues in your patients?
Yeah, so I think all countries, all places are just affected by this, not just in the Philippines, because the moment that a certain city becomes a city, a certain place becomes a city, it becomes more urbanized. There's just an influx of fast foods, from local fast foods to international fast foods. Way back in residency, I there's already a somewhat a running joke around that the moment that there's this top three fast food chains in a country, the moment that their number is increasing in a certain place, the number of dialysis center will also increase, because it's like it's not a direct cause effect, but there's a strong correlation that having these fast foods, inflammatory foods generally eaten on a day-to-day basis, then there's gonna be so much toll in the health of the people consuming it. So I'm not saying that it's directly the fast food that's causing it, but it's the kind of food that really people are choosing. So whether it's fast food or it's home cooked meals, but if it's loaded with sugar, if it's loaded with starch, a lot of carbohydrates that can still spike insulin, and together cooked in toxic oils. So the seed oils, the factory seed oils, and those are really the worst combinations. And the moment there's already inflammation in the body, then everything can be affected, including the ear. So there can be ear pain. We've had even patients who've had hearing loss out of nowhere, no direct cause. Again, that's the one I mentioned: vertigo, allergic rhinitis, polyposis, the occurrence of polyps in the nose, and all of the other things that are a byproduct of inflammation are surely affected. So yes, there is an increasing trend. That's why it's a little disheartening that as these fast foods and urbanization indicate improvement on the financial status of a certain place, sometimes it also equates on the worsening or decline in the health also of those communities. So that's why we are being very vigilant, and we are doing our best to make people as aware as possible in order for them to choose wisely, to choose better on what they consume every day.
Right, doctor. Next question is on insulin and insulin resistance. So the question is, why is insulin resistance never taken into account by the doctors, and how, and do you think testing insulin resistance early on can be a game changer?
Yes, I really think so. So, one of the reasons also why I think, speaking on a personal note, why insulin resistance are never taken into account by many doctors is that not many doctors actually understand insulin resistance because it's already like somewhat a complex idea, a complex concept when it comes to medicine. It's only the specialists in medicine who are actually somewhat more adept on insulin resistance, especially the internal medicine specialists, diabetologists, and the endocrinologists. But for general practitioners, general physicians, insulin resistance is not tackled much. It's only when I started learning low carb nutrition and studying it on my own that I really fully begin to fully understand insulin resistance. And that's when I became serious in making sure that it will not develop in me or in the patients that I manage. And I think it would really be best if we can directly assess it. It can really be a game changer because people sometimes it will be easier for them to believe if they have an objective marker, the one that they can see in the lab. The problem right now here in the Philippines, there's it's not as wide open and it's not as widely available. The testing for insulin level and insulin resistance. Usually it's just an indirect measurement. Like say for example, the persistence of elevated blood sugar, the increase in HbA1c, and the presence of other signs of metabolic syndrome, the increasing abdominal girth, and the presence of dyslipidemia. But otherwise, the direct measurement of insulin is not that widespread nowadays. And I think even if although it would be best, it would really be a game changer if there's a direct measurement of that, but I think it shouldn't stop us to still do our best to avoid it because it can be avoided even without direct measurement of insulin in the person's body.
Right. That's right, doctor. So how can one avoid getting insulin resistant and detect it early on? You mentioned that there are like looking at the person, you can see if the person is getting insulin resistant uh, by the central obesity, etc. So
Yes.
similarly, what other symptoms are there which can be diagnosed early on, and is it possible to reverse insulin resistance, if at all?
Yes. So first things first, insulin resistance, if we can just a short recap about it, it can actually develop when a person is continuously, regularly, and frequently trigger insulin release. So if you always trigger your pancreas to produce a lot of insulin, the receptors in your body, the receptors in the cells that will uptake the insulin, eventually, in a simpler words, it will already no longer work. It will be numb to insulin. So the standard in medicine, that's the reason also why I believe it's not tackled so much. It's because what we do is just give medicine that will force the pancreas to excrete more insulin or force the cell to take in those excess insulin. But that is not sustainable because the effect of insulin in cells will also be not without side effects. There will also side effects, and that's just like development of tumors, of cancers coming from the anabolic effect of insulin, the building effect of insulin. So the more sustainable way to reverse insulin resistance or to avoid getting insulin resistance in the first place is to give your pancreas an insulin break. Make sure your pancreas will get a rest. And how can you do that? Very simple. You just avoid eating foods that will trigger insulin spike. And those foods, number one food would be the sugars. The sugars, the fructose, the starch, which of course we know when broken down will still be turned into glucose. So the
Right.
moment you give your body that rest from needing insulin, your insulin resistance will go down and you will reverse back to insulin sensitivity. So
Right.
If you don't have any marker, any way to check if you have insulin resistance, just start with getting a tape measure or a metric. You measure your height on the vertical height, and then you make sure that your abdominal girth is, or the size of your waist on the umbilicus level, on the navel level, is not more than half of your height. So if your height, say for example, is 6 foot, make sure that 6 feet your height. Make sure that your abdominal girth is no more than 3 feet also. And if you can make it even less, then that is much better. Okay, so other signs of insulin resistance, darkening of creases. So that's those are the ones that you can see in the nape, and also in the you have your elbows and the other creases. So those things you can check if you have that. And the moment that you feel that you're already gaining more weight, more than your intake, maybe there's already insulin resistance. And yes, it can really be reversed. So for those with insulin resistance that's been going on for, say, for example, 10 years, 20 years, it might take a longer time for it to be reversed. But there's no benefit from you delaying giving your pancreas a rest, because the best way that you can do now is at least no longer worsen that insulin resistance, and that alone can already do so much, and slowly it can be reversed.
Right. So, one part of the question is how can we avoid getting insulin resistant? Some of it you have covered, but in short, can you just tell the viewers how it's easy to avoid this situation?
Yes. So very, very much. It can be avoided. First, I think, is if we are educated, if we educate ourselves on how insulin resistance begins in the first place. So as what I noticed, as what I said a while ago, it just begins with a little sugar. When you are still young, say for example, you're still in your teens and 20s, your body can easily process all those sugars, all those carbs. But the moment you reach 30, 40, especially for those who are not physically active, not burning all those extra calories, extra sugars that they are taking in, then you can see that even if they eat the same way, even if they eat even less, but they are already gaining weight more than they did before. And the worst, there are even people who are not gaining weight at all, but who are having signs of inflammation. For others, it can be in the form of tumors. Others, it can be in the form of blurring of vision. Others, in the form of hearing loss. Others, in the form of allergies, adult onset asthma, and all those other signs of inflammation, aches and pains, arthritis, early onset. Now we've seen, before, arthritis is only seen among elderlies, 60s, 70s, 80 years old. Now we already have people in their 20s or 30s. If you go to a spa, there it's seldom you can see senior citizens there. The most people who are going to spa are actually the young ones, who's always having achy backs, achy bodies, and joints. And they even work in the office. They're not even lifting a lot of weight. And it's because of the inherent inflammation that is in their body. So, how to reverse it, how to avoid that? Try to do a food recall, 24 to 48-hour food recall. You can tell me those foods are, and most likely 99% of the time, it's because of the high sugar intake, high carbohydrate, starchy intake, and even those with toxic seed oils, because seed oils may not directly increase insulin, but it can make the cells not respondent to insulin so much. So it can actually worsen insulin resistance without triggering insulin release. Unlike the sugar, who's increasing insulin resistance by increasing so much insulin release. So that's why as much as we try to educate people on eating low carb, low in carbohydrates, we also educate them in making sure that they also take low toxic oil intake. So it can be reversed. I'm sorry, I cannot hear you. Wait.
Sorry about that.
Okay.
Can you hear me now?
Yes, yes, clear.
Okay. So a common question asked is low carb sustainable? In the Indian context where 40%, about 40% vegetarians are there, they consume dairy and sometimes eggs as well, but they don't consume other meat-based items. And similarly, in the Asian context, uh, we all have a lot of grains and seed oils in our food items. So how can we sustain low carb practically in these areas of the world?
So it's really quite challenging, especially for those vegetarians who's consuming mostly just carbohydrates. The way to make it low carb is still possible, but it's going to be a lot more challenging as compared to non-vegetarian. So the hardest part for the vegetarians would be making sure that they get enough proteins and healthy fats from their diet. So the healthiest sources of proteins would be the nuts and seeds when it comes to vegetarians, but they should also be aware of the effect of oxalates that can also have an inflammatory effect in the body. It can increase incidence of renal stones. It can increase incidence of arthritis, even urate arthritis, and also for those who are going into vegetarian, they need to make sure that when they do low carb, they don't go on low calorie. So one way to sustain it, making it a good enough calorie when it comes to the amount of food that they will eat, is to get it from fats. So the healthiest fats that we can consume in as plant-based fats would be coconut oil, especially virgin coconut oil, olive oil, and also the healthiest one would be avocado. So if you can eat avocado on a day-to-day basis, mostly you can already cover your at least 50% of your required fat allowance for the day. And then you can just add nuts and seeds, especially those and others that you can add also. A good kind of protein for vegetarians would be our mushrooms. So mushrooms are almost 100% proteins. So those things, although for me, there's only very few mushrooms that I can take because other mushrooms are too strong for me. But I think there's already, with the advent of the internet and all the cooking videos, you can already make it a very sumptuous meal. And what's good about vegetarians are those who are taking in eggs and dairies. So you have this it's like a cottage cheese. I forgot what's the name of that one. The
Paneer
yes,
in
paneer.
India.
Yes,
Yeah.
paneer. Yes, yeah, that one. So it's paneer. It's a high protein kind of dairy that you can actually substitute in meat, especially that meat, the paneer can easily absorb the flavor of your spices and all those. So those things you can do. I think the challenge only for these subsets of people who are not eating meat would also the flavors because they get what we call in Filipino umay, or they get satiated or oversaturated with these flavors. They get tired of these flavors. It's just the same way over and over again. And I suggest they experiment on making different dishes, different spices, using different kinds of way of cooking in order for them to have a variety of meal. So one thing also is for them to believe that if there's a will, there's really a way. So for me, it's really sustainable. I've traveled a lot in many countries, and I there was also a time together with my mom that we tried doing vegetarian for about 2 weeks. So we tried it and it was okay, but it's just that our body is not so used to it. We felt inflamed after, even if it was a low carb vegetarian. So it's good. for those who eat eggs. So eggs, especially the free range eggs, the ones the organic eggs, those are the healthiest kinds. And they shouldn't be afraid of the egg yolk because as much as it is cholesterol, but cholesterol it is a healthy kind of cholesterol. And even if we don't eat cholesterol, our body is still gonna make cholesterol because we have a daily requirement for cholesterol in our body. So it's really necessary that we eat that. If we consume enough cholesterol, actually our liver will no longer overdo. We will no longer make so much cholesterol. And that's why egg is a really good addition to these meals. And as compared to other Asian countries, like here in the Philippines, rice is an everyday staple. So what we do is just remove the rice, replace it with low carb vegetables like greens, lettuce, salads, kale, spinach, all of those. Or for those who are not fond of eating vegetables, they can just remove the vegetables and their viand or the meat, they can just double it or triple it until they are satisfied. You will be surprised for those who are not yet practicing low carb, you will be very surprised that the moment you do low carb, you no longer feel hungry every 2 hours of every hour. The moment you do low carb, you can sustain 12 hours eating only once, eating only twice in a day, and that's already good enough. You don't need to always reach for that sugar high because we are no longer dependent on sugar, on glucose as a source of energy. We can shift from ketones as a source of energy, fatty acid as a source of energy, and also glucose. But it doesn't need to come from sugar and starch and other high carb foods. Our body can actually create glucose through the process
Yes,
of gluconeogenesis. So
definitely.
those things.
Right.
Yes.
Thank you, doctor.
Welcome.
A lot of questions to ask you, but we are drawing to the close of our session. So I would like to bring in Shashi and Anup.
Anup is here. Okay, anyway, so I don't
Hello.
know if Anup is here. Dr. Josephine, thank you very much for accepting this invite and coming to India virtually to address us. And we love your work, the kind of work you are doing there in Philippines, and you also organize the largest in-person gathering, and your low carb program before the season, that New Year season when people will binge on all those sugary processed stuff was very interesting, and we really enjoyed talking in your program also.
Thank you so much, Sir Shashi, and thank you for inviting me.
So we look forward for more and more such associations and
Yes,
collaborations in coming time. And I think
yes,
we being in Asia, we have the common issues uh, of more and more ultra processed coming in, foods coming in, and more metabolic disease spreading in. So everything seems to be have a very common foundation. So let us collaborate with each other and fight this metabolic disorder or fight the metabolic demon.
yes. Definitely, we will fight metabolic disorder. And of course, I want before I end, I would like to highlight Dr. Don Agpopra,
Yeah.
who's the one who linked us. So Dr. Don Agpopra, I listened to his talk a little while ago. It was very enlightening. Him practicing neurology and also low carb. So we live in different parts of the Philippines, but we collaborate, especially on the National Low Carb Day. So hopefully, I know it's quite a stretch, but if ever you can come on October 6th here in the Philippines, we will have our National Low Carb Day. It's already going our year 3. It's already on the 3rd year of National Low Carb Day, the biggest gathering of low carbers in the country. More than 1,000, going to 2,000 all in all for live face-to-face attendees and hundreds of thousands on online attendees. So thank you
Thank you
so
very
much.
much, and hope to see you in person someday. Thank you very much.
Hopefully. Bye bye.
Thank
Thank you
you.
very much. Thank you for
Namaste.
Thank you
having
so
me.
much.
Namaste.